What's up, guys? Happy Wednesday. I'm coming at you from a new spot here. So tonight we're going to talk about tennis elbow, right? So pain right on the outer part of that elbow being your lateral epicondyle. We're going to talk about how to figure out if you truly have elbow tendonitis in the most common form of it, which is tennis elbow, or which is referred to in the literature now as lateral epicondylgia. And that can be pronounced multiple ways. So last month we talked about shoulder and impingement, and we shared some mobility and strengthening exercises to help tackle those issues. So if you haven't seen that, go back and watch that. Even if you have elbow pain, it's going to be super beneficial to you because there's studies out there, guys, that link mid-back weakness to elbow pain. Okay, so they're saying you can strengthen your mid-back muscles and the muscles around your shoulder blade, and that's going to really help you with your elbow tendonitis. Okay, so go back and watch it if you haven't seen it. So 3 topics for tonight we're going to talk about in detail. Number 1 is the difference between tennis elbow and golfer's elbow, here on the inner part of the elbow. I might have just gave you a little hint there. How long recovery takes for tennis elbow in specific. How to figure out if you truly have tennis elbow is number 3. Okay, so those are the 3 things in detail. We're going to start with number 1. What's the difference between tennis elbow and golfer's elbow? So with tennis elbow, which is going to be our main thing to talk about for tonight, people are going to have pain with gripping, right? Usually with an overhand grip like this, right? So if you have an overhand grip like this, right? If you're gripping a door, especially if you're gripping it aggressively, if you're doing something for work that requires you to grip something, if you're shaking hands constantly throughout the day, so you're a businessman, businesswoman, you're doing a lot of barbell rig work, maybe you're in CrossFit doing dead hangs, toes to bar, things like that, pull-ups. All those things are going to be kind of effective and painful, actually, I should say ineffective for kind of putting pain here on that lateral epicondyle. Another great way to differentiate between tennis elbow and golfer's elbow is kind of think about where the pain is. So where locally is the pain? If it's locally on the lateral epicondyle, on the top part of the elbow to the outside, and anytime you make a fist or bring the wrist back this way, you have pain, that most likely means you're dealing with tennis elbow or lateral epicondylgia. Okay? If you have medial epicondylgia or golfer's elbow, you're going to have pain on the inner part of the elbow in here, which is right above your funny bone there, where you have your ulnar nerve, where sometimes if you press it too hard, you have that zinging down your arm. Or if you tap it, you get the zinging down your arm into like your 4th and 5th fingers. It's because you're kind of hitting the nerve and irritating the nerve. So those are the differentiators between those two. And with kind of golfer's elbow, it's the flexor muscles that are affected, right? So if you stretch those flexor muscles by pulling the wrist back the opposite way into extension, it's going to irritate it. Or if you contract them and shorten them by squeezing it this way, it's going to irritate them. Same thing for tennis elbow if it's really acute or inflamed. All right, so that's number 1, the difference between the two. Keep it nice and short, simple. Number 2 is how long does recovery truly take for tennis elbow? The jury's still out on that. It can take anywhere from 1 to 12 months on average. And this is based on current research and up-to-date data. I've treated people who had tennis elbow and they've gotten better in 4 weeks. I think that's like the quickest I've ever seen it kind of relieve on its own. I've treated people for close to 8 to 9 months and they've still had it for that long period of time. And those people, most likely if they had it that long, it's not really a tendonitis anymore. It becomes a tendinosis. And tendinosis just means that the tendon becomes degenerated over time. So they might even develop a small tear in the tendon or micro tears that can become a full tear, which you need an MRI to confirm. And some of those people I did actually send out for an MRI through the doctor. So keep an eye on that. That's super important. And usually it happens when you have poor lifting mechanics, right? Or you have limitations in mobility and stability that are present. So those are super important things to keep an eye on as you kind of go through this diagnostic process, which I'm going to help take you through as we kind of talk a little bit more through this video tonight. And this guy's also, it really depends on like how you're properly addressing the cause and dysfunction, right? We're going to talk more about that in a second, but you got to figure out the cause of the issue. It might not be at the elbow. It could be somewhere else in the body. Right, so number 3 brings us to that topic. It's a nice kind of transition to that, a nice little bridge there. How to figure out if you have tennis elbow. So there's going to be 4 ways we're going to do that to figure out if we truly are dealing with tennis elbow, or it's just a nagging pain there, like maybe we bumped our elbow or something, not as serious. The first and most probably important thing is we want to do nerve pain screening. So we want to do nerve pain screening by clearing the cervical spine or the neck, right? So that area of the neck, kind of from the bottom of the hairline down to kind of that big kind of bony protuberance that pokes out, which is your C7 vertebrae, that last cervical spine vertebrae on the mid-back area. Okay, so how do we do that? We want to look up, we want to look down, we want to look to the left, look to the right, and then we want to do a slight tilting action, the left ear to the left shoulder, right ear to the right shoulder. That's going to be all the motions at the neck, and you want to see if you're restricted with any of those or if you have pain with any of those. And if you have any like nerve or zinging pain, it could mean that your neck is related. And then more specifically, we're going to do another test to clear the neck, which is called the Sperling's test. It's kind of Usually you have someone else helping you with this, but I'll take you through it. You want to kind of tilt your head back over your shoulder at an angle. So you're going to pull it back a little bit over to the side, then you're going to turn a little bit. And then what you can do is with your opposite hand is you can put pressure on the head going straight down this way, kind of towards your kind of shoulder. So pushing down this way. If you have zinging or sharp shooting pain or electric-like symptoms, then it's a positive test, meaning that's most likely that elbow pain, and especially if the elbow pain gets flared up from doing that test, and most likely the two are connected, and the spine is kind of your current issue. That means the origin of your pain is coming from your spine, from a pinched nerve most likely, and it's not truly tendonitis. Okay, so that's an important test. You want to do it to the other side as well, right? So if I go this way, you know, if I come back, if I tilt to the side, I put pressure through here and I have zinging pain in my elbow, then obviously I want to do it for the other side and see if it's kind of affected on both, and then kind of rule out if it's a nerve impingement, cervical radiculopathy, but we won't talk about that too much. All right, so that's first and foremost. The second thing is we want to palpate the area, see if there's a lot of tenderness or a weird discomforting feeling. Right, so say my right elbow is affected for tennis elbow, I want to find that lateral epicondyle, and you can do that by making a fist, pulling your hand back, which activates the muscles, and all of these extensor muscles of your forearm on the top, they all connect to that lateral epicondyle on the side there. So you want to palpate there, and if it kind of hurts, you poke around a little bit. Right, if it's painful and tender, then you're most likely dealing with the tennis elbow, and your neck is a fine issue that you don't have to like worry about too much. Right, if you're with golfer's elbow, you would just palpate kind of around that funny bone area on the kind of inner side of the elbow. All right, that's the second thing. The third thing as we move on is special tests. So there are three big special tests I like to typically use with people. Number one is Cozen's test. It's resisted wrist extension. So you take say my right hand's affected, I take my right hand, I pull it back into wrist extension, and then I want to hold my wrist here as I try and pull with my left hand down. So I'm going to try and resist me pulling down this way with my left hand. I'm going to try and hold it here, not try and move it. If I have pain from activation of that, then it's most likely positive for elbow tendonitis or tennis elbow. All right. The next test is Mills test. The examiner tries to extend your elbow while pronating your hand as they palpate. So this one's kind of hard to do on your own. You can have a friend do it if you want, but I'll show you with my left arm. I want to kind of extend the elbow straight out and then pronate the hand downwards like this. So I'm kind of doing this and this, boom, 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 right? And if I have any pain here, because I'm putting stretch on the tendons now, then I'm most likely dealing with tennis elbow. All right, that's the second one. The third one and final one is Maudsley's test. This is resisted middle finger extension. If you have pain with it, it's positive for elbow tendonitis. So this is the simplest of the tests. You're going to take your hand out like this. You're going to really pull that middle finger up, hold it there, and try not to push it. So I'm trying to push it down with this hand. I'm trying to resist with the other hand. If I can't move it and I don't have any pain, then it's a negative test, right? If it kind of drops and I have pain with it, it's a positive test because the pain was from activating the muscles of that extensor digitorum muscle there. Okay, so that's the third thing, special test. The fourth thing and final here is kinetic chain screening, right? So I mentioned this before in the beginning of the call. If you were paying attention, you heard me. You want to pay attention to wrist mobility and stability. So you want to make sure you clear the joints above and below your elbow. So you want to look at your wrist in more detail. You want to look at wrist flexion range of motion and wrist extension range of motion. Most people are limited with their wrist range of motion, which can affect how much stress and strain gets put on the elbow. Because they're doing push-ups and they don't have that range of motion of getting this, right? So a lot of strain is going to go through the elbows, and that's going to lead to overuse and discomfort, right? Could be weakness of the kind of muscles around the hand as well. Maybe you're not using your hands, or maybe you're using them too much from overuse. Could be either or. The next thing is shoulder mobility and stability. You want to clear that joint above your elbow, which is your shoulder joint. So you want to look at your shoulder range of motion. Your shoulder has 6 motions in detail. You want to go through all those motions. And then you also want to look at strength. So you want to get your strength tested, which is stability. Right? Strength and stability can be kind of intertwined with each other, one used for the other. And you want to make sure you have good strength on your injured side compared to your good side. Right? You want to try and match that side. Because if you have weak muscles, especially periscapular muscles around your shoulder blade, or really weak mid-back muscles, that's going to mean that it can affect your elbow. And guys, to be honest, a lot of times I used to get stuck with people when I first started working as a physical therapist, and I would just sit there and I'd take Graston tools and take my hands and I would scrape the heck out of all these elbows. People would feel really good when I did it. Then the next day they'd be in more pain, or they'd be like, my pain feels the same. And then I really started looking more at the shoulder girdle, looking at their range of motion. A lot of people had tight pecs and lats. I gave them stretches for that. They had really weak external rotators and kind of mid-back muscles like their middle traps and lower traps. And we gave them strengthening exercise for those. 4 to 6 weeks later, they were pain-free. And we didn't directly touch the elbow at all. And at first people were skeptical. They're like, you're not going to touch my elbow? Like the elbow is where my pain is. And it's crazy because like a lot of times, like if there's a kink in the chain somewhere while you're going through your diagnostic tests and you find that kink, address it, and it's going to help fix things below that kink. Okay, it's just like a hose if it gets stuck. Say you're like about to kind of wash your car. If there's a kink in the hose, obviously no water is going to come out of the other end. Water is coming out of one end, but the other end is not going to kind of make its way down because of that kink. So you got to find that kink, which is your dysfunction, and address it. The other thing is thoracic spine mobility. You want to make sure you address mid-back mobility because that's important, and that goes along with posture. So this all makes sense, guys. Put it right down in the comments below if you have questions or anything. That was a lot to cover in detail there. But just to recap, we do nerve pain screening first, we palpate second, we do special tests third, and then we do kinetic chain screening fourth. Okay? So guys, do these tests if you didn't do them while you were watching here. List below if you have any questions. If you're dealing with tennis elbow, and you're positive with all these tests, then obviously reach out to me. I'll be happy to help you, or try and see a local physical therapist who can help you. Even occupational therapists tend to treat elbows a little more than physical therapists. If you really want to get specific, certified hand therapists, which are a form of occupational therapists, also treat. So you can kind of go that route as well. And guys, all I ask is that you share this video with someone else who might be dealing with these kind of elbow symptoms as well, because not everyone can afford physical therapy services. So they can kind of hop on YouTube if they're paying for internet, or they can go off of someone else's Wi-Fi, and they can obviously watch these videos and kind of learn from them, diagnose themselves, right? And then kind of learn what to do. Because we're going to talk about next week how to start pretty much with treatment and where to go from kind of now figuring out that you have tennis elbow. So thank you guys so much for watching. If you're on Facebook, feel free to comment below. If you're on YouTube, feel free to comment below. And yeah, we'll look forward to see you guys in the next one. Take care.